Hello, friends and neighbors. This is John on CGTV 5, and it's time again for Burger Beat, our community affairs programming here on CGTV 5, brought to us by Berger Health Systems. And today on Burger Beat, I've got at the other end of the long banquet table here Dr. David McMahon. He's a MD of internal medicine, and he works at Pickaway Health Services. So to start off, Doctor, let's hear a little bit about your background and what brought you to Pickaway Health Services.
Well, background starts a long time ago, originally from Chicago. And after I'd gotten out of the service, I did my medical school at the University of Chicago and internship at Tulane in New Orleans in internal medicine. And then did a residency for 2 additional years at Michael Reese in Chicago. And was in practice there for a number of years and then moved to the Columbus area about 15 years ago. And
Came with Mount Carmel Systems?
Originally came with Mount Carmel, was brought in to run the outpatient clinics, worked there for about 15 years, handling the outpatient clinics for the residency program with the residents, and then having my own practice in addition to that up until earlier this year when I came down here and joined PHS.
And PHS, Pickaway Health Services, is what I read, 22 doctor, multi-specialty physician group practice. What are the advantages and or disadvantages of these multi-group practices that we see more and more of anymore?
Multiple group or larger practices makes life a lot easier for the physicians because then you can concentrate on taking care of patients rather than having to worry about the mundane, I call it that way, day-to-day, how do you run a business, which is something I had done in Chicago and found that being in the business makes life more difficult than practicing medicine. So, and why multi-specialty? Because then you have the backup when you need it, better communication between areas when somebody needs some assistance from the subspecialists or other members of the group.
Yeah, and you're in Grove City. PHS has offices in Circleville, Asheville, Laurelville, Orient, and Grove City. Where are the offices there?
And Grove City is right at I call it the south end of Hoover Road, 6024, right at 665 and Hoover Road.
Okay, yeah. And what kind of patients are you seeing at the Grove City office?
I'm a internist, which means it's one of those questions people ask, what does an internist do? What's the difference?
Isn't most of medicine internal to speak?
Well, there's those external parts called the arms and the legs in a way. But we handle essentially adult medicine. That's what the training is in. Family practice, for example, will handle, when they're training, they'll do some pediatrics, they do some surgery, they do some OB, they do some adult medicine. We just concentrate over the 3 years of training on adult medicine. So it's those above the age of, it varies. I start roughly around adolescence, age 14 on up, handling that, which means we have a much older population in the sense of above, the babies and that. So we concentrate on adult medicine.
Yeah. Everybody's a specialist in medicine anymore. Is the family practice physician a thing of the past?
It's difficult. Not an expert that much on family practice. A number of years ago, we're talking 20, 30 years ago, you had the general practitioner, and then that became the family practitioner, which has the training. But the problem comes is it's very hard for them to do everything that they're trained for. OB in a place such as Columbus area, Circleville, with the OB gynecologists, the specialists in the area, it's hard to compete, to do the deliveries, to get enough of them to keep that experience up, which is what we find in all of the areas of medicine. There's more and more knowledge, hard to do everything. And so a lot of the family practice people will do peds and adult medicine. And then we handle, as I said, just adult medicine as such. And so we concentrate more on those areas, both in training and in what we do.
And in a group like Pickaway Health Services, you've got each specialist lined up, as you said, for communication and somebody to fall back on or referral to in your own practice. Why internal medicine? Why did you choose internal medicine?
I like to have to think. It's one of those, it's less procedural. than the subspecialties. With that, I would say that most of the subspecialties in medicine, such as gastroenterology, GI diseases, nephrology, kidney diseases, are subspecialties within internal medicine. So those are individuals that take original internal medicine and subspecialize. But the general internist, which I am, dabbles very deeply, I would say, though, within those areas.
Right.
And then we get our colleagues who are more procedural. For example, somebody needs to get scoped because there might be an ulcer or a problem in the colon. We'd call in the gastroenterologist to do the procedures.
Yeah, as I said, everybody's a specialist.
Everybody's a
anymore.
specialist, and it's
Are there any certain diseases and/or conditions that you prefer to deal with, or are the best at?
I don't know if there's anything the best, because a lot of times when we're taking care of people in internal medicine especially, it's multi. As we get, and I always call it the 5-letter word, older, we tend to have things happen. Hypertension, diabetes, arthritis, and even to the points of things like Alzheimer's, neurological problems, strokes, heart attacks, all those areas I enjoy doing, because that's part of the reason I like general internal medicine is you're able to work in all those areas and how they interact and really getting the patient to be in charge. It's more fun than just thinking of one particular part of the body.
Right.
Everything's the heart when you're a cardiologist.
Right, right. So whole health,
Whole
or
health.
whole body
More
health.
Of,
yeah.
more of that, and then that's a lot of what I end up doing is working as the, I call it the translator between the subspecialists sometimes.
Okay.
Because, how does this fit to that, and how are these things interacting? That's a lot of what we do.
Yeah. You mentioned that you had came to Central Ohio with Mount Carmel Health Services, and why change to Pickaway Health Services? What brought about that move?
Well, part of it is the change in medicine that's going on today. I'm concentrating more in outpatient. When I was at Mount Carmel, I was with the medical education department and had been there for a number of years. And it was just a confluence, to use a fancy word, of factors. Both a change in the program there, new director, wants his own people, and also I'm at the point where I'd like to concentrate more in outpatient. I was doing as much inpatient, outpatient, and it's hard, and I'm seeing this. There's a new term we use called the hospitalist. It's hard to be an expert in both in-hospital medicine and outpatient medicine. And so I'm concentrating more on the outpatient. And then lastly, my life's a little easier because I don't get quite as many calls.
Right, right. In a large group.
In a large group.
It leaves you some spare time. Does that fit into your personal philosophies on being a physician then?
It really does. And part of it is because one of my, if you will, problems with inpatient hospital medicine in many circumstances is that every patient's, when you're a hospitalist, is a new patient. And I rather like the long term. I like to have a patient that I'm working with. You see them, you do the follow-up. As I like to put it, my goal is to keep you out of the hospital and keep the person well and working together over the long term rather than just an acute care problem. So that's more of in the philosophy. Always have been that way, which is why I would see my patients in the hospital before. Now it's just a question of making sure they get the best care.
So do you think you're doing more preventative medicine than reactive medicine in that case?
I like to pretend. I've always done that. But I'm finding that it is much easier when you're concentrating to make sure that you're really, I'll use the expression, following the guidelines, doing the preventative because you have a little more time. You don't have to be two places at once, in the hospital and out.
Yeah. You've been practicing for over 20 years. What are your thoughts on having patients take care of their own health?
Big fan of it. Which is sometimes difficult because we're trained. Somebody once put it, there's a pathology. People who go into medicine like control. We like to be in charge of things. I mean, if anybody's seen and I mean this in the best sense with our cardiology fellows and physicians, they like to be in control. They like to tell you what to do and you do it. And I found that I can prescribe any medication I want, but if the patient doesn't take it, it absolutely does